Effects of Play-Based Curriculum in EC-6th by Margarita Tovar. Abstract. This literature review is on play-based curriculum in elementary school years. Play-based curriculum offers students and teachers a different way of obtaining students' social, emotional, and academic achievement. This literature review examines the effects, if any, of play-based curriculum in student ages 5 through 12. My purpose was to find literature reviews that help me answer the question, what are the effects of a play-based curriculum during the elementary school years? Are they positive, negative, or neutral to a child's academic and social development? Methods. I use the following terms in databases ERIC and PsycInfo to find articles related to my literature review. In the ERIC database, I obtained 130 hits, and the PsycInfo I obtained 80 hits. My criterion were the following three, and many of the articles and journals that I found did not meet all of them. That is why I only included 6 articles that met my criteria and supported my purpose. The first one was Peer Tutoring with Child-Centered Play Therapy Language. In this article, 14 fifth graders and 17 kindergartners participated in tutoring sessions where fifth graders were allowed to teach kindergartners math and language skills through a playful manner. As a result, fifth graders increased socially, and kindergartners' academic and social development increased as well. My second article was the use of play materials in early intervention, the dilemma of poverty. This article was a total of 320 intervention specialist surveys, and they were surveyed as about their experiences helping low-income families and parents teach their children through play-based strategies. I like this article and I included it because the results show that many families have few play materials, and the toys that they do have are incomplete, dirty, broken, or not developmentally appropriate. So how do we expect our children to thrive in a playful manner when the toys and the resources that they have are not developmentally appropriate? That is why I included this article, although it didn't focus specifically on the children. It focused on a reason to support my thesis. My third article was the effects of group activity play therapy on problem behaviors of pre-adolescent Ugandan orphans. This article had 60 displaced Ugandan orphans ages 10 through 12 exhibiting clinical levels of behavior problems. They were divided into 2 groups, and the control group received group activity play therapy. As a result, 16 children who received group activity play therapy and presented borderline or clinical range of behavior at pretest, 12 moved to normal functioning levels, 2 moved from clinical to borderline, and 1 remained at borderline level. This article shows that play-based curriculum strategies have a positive effect on social and emotional growth. My next article also showed a positive effect on social and emotional growth, and this one was Therapy Reaching the Child with Autism. The participant was a 7-year-old boy with autism who participated in 12 sessions of sand play. After 8 to 12 weeks of sand play, the student had less visits to the school detention center, and the child also interacted and communicated more with the researchers. The next article was the evaluation of a pilot parent-delivered play-based intervention for children with ADHD. This article demonstrated that children's social play outcomes increased significantly from pre-test to follow-up test, demonstrating social emotional growth. My last article was using a narrative and play-based activity to promote low-income preschoolers' oral language, emergent literacy, and social competence. The participants were 149 low-income preschoolers, almost 3 to 4 years of age, and the experimental classrooms had storytelling and narrative and different play-based curriculum strategies that help them increase their print and word awareness and their beginning sound scores. Their pretend abilities also improved. This article demonstrated that there is academic growth related with play-based curriculum as well as social and emotional growth. Some limitations that are included in this article is that this is completed as a class project and it's not an exhaustive review of the literature, and there may exist other published articles that were not found in my database due to my keywords or conditions applied. As a conclusion, I find that there is positive correlation between play-based curriculum and social, emotional, and academic growth. Although not enough data on academic growth was found, there is enough evidence to conclude that socially and emotionally students benefit from playful interactions. Students in low-income families need storytelling, exposition to oral language, play materials, and different methods of interaction between students, teachers, and parents. I conclude my literature review with one of my favorite quotations by Albert Einstein, which is, "Play is the highest form of research." I hope that you guys have a wonderful end of spring term, and thank you, Dr. Trevino, for all of the things you showed us through this course. I am very grateful for this experience, and I wish you the best.